Hello everybody, welcome back to our today class. Today class is actually important. We'll be trying our best to finish up the gram-negative organisms today. So let's take a look. I hope you did the sketch for today, since this will make my job much more easier. So before I speak about anything, can any of you please can you please remind me, is Listeria intracellular or extracellular, or is it both? Is Listeria okay? Yes, I am. So we call it facultative intracellular, which means it's both intra and extracellular. What allows the Listeria to go inside and outside of the cell? What allows Listeria monocytogenes to go inside and outside of the cell? Excellent. This is a common question. They ask about what allows it, and it's basically this actin polymerization, which we also call it like the rockets. And to understand the rockets, you have to take a look at this. So if you take a look at these are the Listerias, yeah? But these Listerias are super smart. They can move. How they can move? Let's take a look. Yes. See? They can have this rockets that will lead to their motion and movement. So as you can see, the Listeria now, like this is cell A, this is cell B. The rocket antigen, which is basically actin polymerization from the back, help it to keep going. The moment it enters the new cells, it steals some of its membrane. And now it loses it and divides and able to start again moving by making these rockets. Yeah? If they ask you what are the rockets made out of, can somebody tell me what the rockets made out of? Actin. Excellent. It's actin polymerization. Good. So let's keep going. That was just a quick review. And today we are going to speak about pertussis. So pertussis, back in the time, they used to call it the 100-day cough. Why? Because it's a cough that persists for 100 days. Well, okay, so to start about pertussis, first of all, what is it? Is it a virus or a bacteria? Bacteria. Okay, so so you can use antibiotic against it. That's what I want to reach. I want you first of all to know how it looks like. The bordetella pertussis, it's a coccobacillus, which is like between a cocco and between a bacillus, coccobacillus. A cocci is basically a circle and the bacillus is a rod, so it's between a circle and a rod. Yeah? The second thing to know, that it's aerobic. So think about it. If it's aerobic, would it affect mostly the lung, or it would like to affect any other visceral organ that lacks a lot of O2? The lungs. It will affect the lungs mostly. For the new members, please, the answers will be written on the Telegram groups. This way I can see them on my other monitor. So the virulence factor include pertussis toxins, which disables the GI. You're like, what? Well, GI. What is GI? Well, basically, there is something called secondary messengers. If you remember, we have this GS, GQ, and GI. Yes? The process of GS, the main thing of it is to make cyclic A and B. And Well, let me see. No. It's not related to that. It's the same exact receptor, Nicole, but it's not the same story here. So the secondary messengers, which are the G's, we have the GS, the GQ. What do they mean? Basically, if you have a cell and you have a receptor, this receptor, its way of talking to the inner machinery of the cell is using a G protein, which is an intracellular protein, which we call a secondary signal. This secondary signal will control everything that will happen forward inside of the cell. So basically, the GS will lead to more cyclic AMP. Yes? GI will lead to less cyclic cyclic AMP. So GI will lead to less cyclic AMP. Now, the pertussis is inhibiting the GI. So what will happen to the cyclic AMP, up or down? I'm inhibiting the inhibitor. I'm inhibiting the inhibitor, so more. Absolutely correct. Good. So I will have more cyclic AMP. Okay. Also, there is something called a tracheal cytotoxin, which kills basically the epithelium inside of your trachea. Let me ask you about this. Which type of epithelium we have inside of our trachea? I made a file called circulatory, in which there is every single type of epithelium in the body. You can check it. It's in the group info. It's put in there. You can just go and take a look about each epithelium in different organs in the body. But inside of the trachea, it will be respiratory epithelium. The respiratory epithelium, it's a columnar epithelium, okay? Why would I like a columnar epithelium? Because it has a really good blood supply. And if it has a really good blood supply, it means that it's hot or cold. Yes, exactly, it's quite hot. And this is important because the air will come back through your trachea and reach your lung. So when the air that is coming from the outside atmosphere coming to your lung, would you like it to be warm or would you like it to be really, really, really cold? That will decrease your internal temperature. You want it to be warm a little bit. So that's why the trachea has columnar epithelium. Okay, this columnar epithelium also has cilia on it, which contribute to what? Something called mucociliary escalator or apparatus. The idea of this is that inside of the trachea, for example, there is this mucus layer and there is this little hair layers, as you can see. And these little hairs with this little mucus, the bacteria will be stuck to this and this cilia will kick it out. Guys, do you remember which disease we spoke about? I mentioned this mucociliary escalator in, and I told you it will be it will have a defect in it. In which disease the mucociliary escalator will be damaged? It's true, smokers will have destruction of the mucociliary apparatus. But if I showed you this picture, if I showed you this picture of the patient, what will your answer be? Will it change? It's a CT scan of a patient who is infertile, and he comes to you because of his infertility. You do a CT scan for some other reason. You notice that his liver is on the opposite side. Liver is supposed to be on the right side, but now the liver is on the left side. Spleen is supposed to be on the left side, but now it's on the right side. He also has dextrocardia, which is a heart located on the right side. All of this is abnormal. Basically, all of his body organs are upside down. This we call situs inversus. Excellent. It is primary ciliary dyskinesia, also called Cartaginer syndrome. Yep. Excellent. So that's the other disease in which the mucociliary apparatus will be damaged. Yes, because they cannot have normal cilia beating. Why the cilia cannot beating? Because of the dynein arm failing. Yes. What is dynein arm? It's an AT-base, that an enzyme that help in the movement, basically. Yes. Okay. Good. Okay. So the next thing is the clinical stages. There's the 3 clinical stages of bordetella pertussis. The first one is the catarrhal stage, the paroxysmal stage, and the convulsant stage. The catarrhal stage, these patients will have like this rhinorrhea from the nose. Yeah, they can have this rhinorrhea from the nose. They can have also coryza. Guys, what does coryza mean? What does coryza mean? Well, okay, well, look, guys, the idea of coryza that you will be having the catarrhal inflammation, that's correct. You will be having this basically rhinorrhea from your nose. Your eyes will be lacrimating, but it will be really bad, something like this, okay? And basically it's like runny nose, lacrimation from the eyes, all of these catarrhal symptoms of everything secreting so much, okay? So let's take a look. Okay, this is all at the catarrhal stage, in which they have low-grade fever and coryza. Okay, is the disease treatable at this stage? Yes or no? Yeah, that's correct. So next we have the paroxysmal stage, which is quite long, okay? So it's paroxysms, which means it comes with and go of intense cough, following by an inspiratory whoop. So I hope you understand what this means. Basically, it's something like this. The problem that we say it's whooping cough, whooping cough. What does whooping cough mean? Well, whooping cough, it's like this animal. It's like a chicken, yeah? So whooping cough is coughing like a chicken. Well, how does a chicken cough? Well, basically, they they gasp for air. So they coughing, 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 coughing until they don't have any more air in their lung, and they suddenly they do what? They take all of the air back. Can you hear my screen, guys? Can you hear the video? Yes or no? Can you hear?
Yes, yes.
Excellent, good. So as you can see, the sound only comes when? After he coughs everything. So like it's like no more air in the lung. And then, so the characteristic sound is not because of the cough. It's because of the gasping of the air. This is important. On the USMLE, they never tell you whooping cough. They don't. They will describe it. They tell you, oh, this sound that was intense sound happened after progressive type of cough, which means like this is a description of whooping cough. They will tell you it's an inspiratory sound that happens after an intense cough. Okay, guys, the cough is really bad. I want you to make a note. In bordetella pertussis, because the cough is so bad, in children, it can lead to apnea. In children, it can lead to apnea. In adults, it can lead to vomiting. I will be asking you again about this. This is high yield. So in children, it leads to apnea. In adults, it leads to vomiting. Done. I mean the cough, of course. So they have this pertussis vomiting. What does the word tussive mean? Does anybody know? Yeah, let me see. Yes, basically it's cough. It's cough.
Where can we type the answers?
You can type your answers on the group 4. If you don't have it, I will send it to you right away.
Yeah, I don't have it. Thank you.
Just a second. Okay, so the next thing we have is, yeah, post-tussive vomiting. The word tussive means coughing, okay? And the next thing is convalescent stage. So what is this convalescent stage? It's a gradual recovery of chronic cough. Guys, how long does the bordetella pertussis infection last for? How long does it take from its beginning to the end? More than 2 months. Well, approximately, to be fair, it takes around 3 months. And the old Chinese people used to say the 100 days cough. So, yeah, a lot of days. If you don't treat it. Do we get vaccinated for it regularly? Yes or no? Yes. Excellent. How often you should get a booster, which is like an injection of the vaccine to keep your immunity up? Every 10 years, that's correct. So it's prevented by the Tdap and the DTaP. You are like, what? They look exactly the same. They are. The only difference is one you give for children and this you give for adult. So what is the treatment? Macrolides, like azithromycin, clarithromycin, all of the good stuff. And if allergic, TMB, SMZ. 1 second, guys. I will just allow our new member to basically be able to write her answer, because otherwise she cannot. Okay, and done. Okay, good. So okay, so if the patient is allergic, if he's allergic to macrolide, you can use TMB SMZ. But TMB SMZ, some patient cannot take it. Do you remember which category of patient we spoke about in yes, sulfa allergy, exactly. So, oh yeah, G6PD deficiency, absolutely correct. Yep. Good. So the next one is a disease called brucella. Brucella, I hope you did the sketchy for it. Oh, before we speak about sketchy, guys, I want you to know one more thing about pertussis. We spoke about more cyclic A and B. So why is this bad? Basically, more cyclic A and B means more pumps working, okay? More pumps working means localized edema. The localized edema means irritation. Irritation means cough. This is how cyclic A and B, exactly. This is how cyclic A and B leads to the cough. This is the mechanism. So, now brucella. Gram-negative aerobic coccobacilli. It's transmitted via ingestion of animal product, like ambassadeurized milk. I want to show you, first of all, the sketchy. Let's take a look at sketchy. So, in sketchy, if you remember, I hope you had the chance to look at the video. By the way, for the new members, before each class, like only in micro, I tell which videos you should watch, so next class it will be easier for us. So to start with the brucella, there is a few things that are super important to know. First of all, it's related to farms. For example, it happens from from the animal, what we should get from the animal to get infected. Well, there is two things. The first one, according to Sketchy, is this, the milk. And one more, it's not mentioned in Sketchy, but it's the amniotic fluid for the, yes, unpasteurized milk, and also the amniotic fluid of animals in the farm. Okay? Yes, 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 absolutely correct. Good. It's a gram-negative aerobic coccobacilli. It's transmitted via ingestion of contaminated animal products, like unpasteurized milk. It survives inside of the macrophages of the reticuloendothelial system. About which other microorganism this reminds us? An organism that can survive inside of the macrophage. Absolutely correct. It's tuberculosis. So, in tuberculosis, I told you how it survived inside of the macrophage. Can you tell me, please, what was the factor that helped it to survive in case of TB? The cord factor. Exactly. Good, good, good. So, these patients, the most can form non-cassiating granuloma. This is an exception. Why? Because you remember, guys, in general, cassiating granuloma are in which type of diseases? Infectious, like fungal disease, everything like that. It's always what? Cassiating. If it was autoimmune, like Crohn's disease, sarcoidosis, all of that, it will be cassiating or non-cassiating? Non-cassiating, exactly. So here comes the exception. This is like actually the only exception in the book. I was afraid to tell you about it, but now it comes. I'm forced. So, non-cassiating granuloma. So, a non-cassiating granuloma, what will be in, let's mention the difference between cassiating and non-cassiating. What will be in the center of a cassiating granuloma? In histology, I mean. Yes, the necrosis. The cheesy-like material will be in pathology, like in a gross pathology, you are right, but in histology, it will be central necrosis, yeah? So this is the central necrosis, and guys, can you see here one cell that has so many nuclei inside of it? I know this is a bad quality image, so let me find something better. Yes. Can you see one big cells with a lot of little nuclei inside of it? What is this? How do we call a cell when it has so many nuclei inside of it? You are absolutely correct. It's a giant cell. Good. So that was a giant cell. Nice. So let's take a look at this one. Yep. Can you see the giant cell here? Cute. I know. So here is a giant cell. Okay. Let's keep going. So that was a brucella. One more fact about the brucella, to be faithful with you guys. This is the only question you will get about it. The undulating fever. What does it mean? This fever goes up and down, up and... Oh, screen stuck. Let me check. What about now, guys? Is it working? Excellent. Good. So, this type of fever goes up and down, up and down, up and down. When you see a patient that has a fever lasting for 4 days, 4 days, then it disappears. Then 4 days and then it disappears. Then 4 days and then it disappears. And they tell you that he came back like, I don't know, some weird question of him being traveling outside of the country, like to Africa, and now he's back. What you will choose? Excellent. It's malaria. So you need to be careful about this fever that comes and go. Okay? Yes, similar representation. That's why I mention it here. Because it's all about the history. If they mention for you somebody who works in the farm in the US, you will not choose malaria. You will go with the brucella. But if they mention for you somebody with jaundice, like pig liver, stuff like that, and he's coming back from Africa, this is a brucella. They just want you to know the presentation. Guys, brucella is a systemic disease. Systemic diseases tend to cause night sweats, arthralgia, and this arthralgia like the joint pains, you know. Does anybody, well, we did not study this yet. It's one of the malabsorption syndrome in which it's caused by a bacteria, also treated by a doxycycline, and it's people coming from other countries who will have arthralgia, endocarditis, and arthritis. Any idea? Well, there is a disease, it's a malabsorption syndrome. Basically, they will have fatty diarrhea. This disease, these patients will also in the same time will have arthralgia, which is like arthritis-like symptoms. They will also have endocarditis and so many other stuff, systemic stuff. We call it Whipple disease. So we call it Whipple disease. And this Whipple disease, when the patient have it, they can have which vitamin deficiency, guys? Which vitamin deficiency can happen in the patient when he has a fatty diarrhea 24/7? The fat-soluble vitamins, excellent, which are A, D, E, and K. Yes. So also this patient having this problem because of the bacteria, basically, yeah? So the way to treat him, see, this is the Whipple disease. The way to treat him is with doxycycline. It's believed to be from an animal origin, so the treatment is doxycycline. Now I will give you a little trick that I personally use. You can use it as well. If I speak about the Francisella tularemia, you know, it's from which animal? The rabbits, okay. So what is the treatment? Doxy, okay, good. And now we are speaking about the brucella. It's also from animals. What is the treatment? Bubonic plague. It comes like, you know, from rats, from dogs, stuff like that. What is the treatment? Yes, Lyme disease. It also comes from like, you know, the host, the deer. And what is the treatment? Doxy. What I'm trying to tell you guys that most animally originated infection are most of them, not all of them, but most of them are treated by doxycycline. All of this zoonotic infection, doxy. Don't waste time in memorizing so many diseases. It's doxy. And yes, also you can use rifampin or streptomycin. Good. Oh guys, we will memorize every single antibiotic. Just wait for it. So, Legionella. So Legionella, before we start, which electrolyte disturbances happens in Legionella pneumophila? Which electrolyte disturbance happens in case of Legionella? Excellent, it's hyponatremia. Hyponatremia. Good. Decreased sodium. Excellent. Guys, personally, I did not know this, but apparently it's an English word that I did not know about, okay? So there is something called the whirlpool, okay? This whirlpool is like jacuzzi, you know? So we mostly use the word jacuzzi, but whirlpool is the correct English word for jacuzzi. For the US simile, they use whirlpool. It's kind of annoying, but you need to know it. You know why I'm speaking about jacuzzi and Legionella? Why Legionella is associated with the jacuzzi? Yeah, because it likes water. Yes. It likes the water. Absolutely correct. Good. So let me send you this. Enjoy. So, it's Legionella is a gram negative, but if I stain it, will it stain? In a gram stain, it will stain super bad, okay? So actually, this is quite a good stain, but in general, it will stain bad. It will be almost impossible. to stain it. But so we use a different type of stain. You are correct. It's silver stain. Okay? So it's silver stain. I want you to get comfortable with the silver stain, like to take a look at it and be able to know what you are looking at. So here you can see something. Where is the bacteria? Is it the yellow stuff or is it the black stuff? Exactly, it's the black stuff. The little black stuff is the bacteria. That's how you diagnose it on silver stain. Yeah? So let me just send you one of them. Yep. Okay, good. So the next one is something like this. So it grows on charcoal yeast extract medium with iron and cysteine. You are absolutely correct when you said about the cysteine and iron. Okay, so bacteria like iron. This is a fact. If you remember when we spoke about pathology, we spoke about acute phase reactant. One of the acute phase reactant used to hide the iron from the bacteria. Which one was it? Which one used to hide the iron from the bacteria? Which acute phase reactant used to hide iron from bacteria? So basically, remember we had many acute phase reactant. One of these, so many acute phase reactant, for example, we have something called hepcidin, yeah? So hepcidin used to inhibit a channels called ferroportin. Ferroportin is a channel located at the epithelial cells of your gut, and it moves iron inside of your body, yes? So if somebody is using hepcidin, this ferroportin, will it be functional or it will be destroyed? It will be knocked out. No more ferroportin. Exactly. So can you get iron inside of your body? You cannot. So no iron inside of the body means anemia. Yes? So these patients get anemia of chronic diseases basically. Yes? So they get anemia of chronic disease because of the acute phase reactant basically. Yeah? Also, this ferroportin is located on macrophages and it allows the excretion of iron from the cells, from the macrophages to the outside. So hepcidin, he's an acute phase reactant, so he will knock out this ferroportin as well, yeah? Which will also lead to reduction of the amount of iron, leading to anemia. Okay, anemia of chronic disease. So, why the body is doing this? The body is doing this to hide the iron from the bacteria. Bacteria loves iron. It makes enzymes out of it. So we don't want it to do that. So detected by the presence of antigen in the urine. Oh yeah, this is super important. You need to know that the antigen is located in the urine. If you have done sketchy, you know how to remember that. It's about the boy. So the lab will show hyponatremia. Is hyponatremia bad, and if yes, to which organ? Which organ is hyponatremia super serious for? Well, the kidney like to regulate it, but actually the organ that will really get messed up is the brain. Yeah, the brain. Why? Because when you have hyponatremia, the water will be sucked from the vessels, which has low osmolality, to the brain tissue. Yes? So this is bad. Okay, let's think about this. If I have hyponatremia, you get a patient with hyponatremia of 114. Should you correct it immediately back to 145? Should you correct it immediately? You must correct it super slow, because if you correct it quickly, you will get this Bunting demyelination syndrome. So you must correct it. This is step two. It's a step one question about getting the Bunting demyelination syndrome, leading to man in a battle. So what is this man in a battle? Basically, these men are stuck. Okay? What do I mean by stuck? Look at this guy. See his arms? He cannot cannot raise his arms. They are stuck. See? He can keep trying all day long. He cannot move his shoulder up there. He cannot. He's stuck. It's like being inside of a barrel, you know? It's being like, yes. Yeah, something like this. Man in a barrel, but even the barrel is hiding his hand. Yeah? Yes, something like this. And imagine his hand are going out from here. This is man in a barrel syndrome. I like this one. So that's a good illustration. This is man in a barrel syndrome. So is it permanent? It depends on the age. If it's happening, like most likely it will be in an older age. So the answer is yes. So the answer is yes. Okay, well, let's contrast it with the Sydenham chorea. Remember about the Sydenham chorea? It happened in which disease? The chorea. Yes, strep biogenes. You are right. It happens in Huntington, but I'm speaking about an infectious disease related thing. Rheumatic fever. Yes, rheumatic fever. Is rheumatic fever an infectious disease or an autoimmune disease? Autoimmune disease. Excellent. Which type of hypersensitivity reaction is it? Type 2. Absolutely correct. Good. We have sharp people here. So, please know Legionella has an arousal transmission. So if somebody gets it, it gets into the ventilation system of the cruise ship, and you will know why I speak about the cruise ship in a moment. It will get to the ventilation system and it will infect everybody. Yeah. So arousal transmission from environmental water sources habitat. For example, air conditioning system. Yes, or hot water tanks. Outbreaks are associated with the cruise ships, nursing homes. But the cool thing, there is no person-to-person transmission, okay? Guys, I want you to be comfortable with one factoid, actually. You know, at the supermarkets that, like during summer, there is this machine that sprays the vegetables, yeah? I think we call it like sprinter or something, I forgot its name. Does that mean like when you breathe the water or what? I don't get. Yes. So how how do you get Legionella? So Legionella comes from the air conditioning system or the hot water tanks. How come? Guys, you know this vapor that comes out from these machines? Like there is this little vapor. It's like when you chew, there is like little vapor also. You inhale that. Okay, and the vapor contains the organism itself. It's kind of difficult to get enough bacteria to cause a pneumonia from person to person transmission, because you will need to have it for quite a while to get enough bacteria, you know, to get the enough bacterial load to get the infection. So one sneeze to the face will not give it to you, but being under an air conditioner that is loaded with Legionella for 6 hours, that will do it. So, yes, but please know about this. Yeah, I was looking for these words. Thank you so much. Sprinkler. Yes, sprinkler. They use this exact word, and it's about like it sprays the vegetables to keep it looking fresh, you know, fresh and full with Legionella. Yep. So, the treatment is with macrolide or fluoroquinolones. Please keep in mind that how they represented in sketchy. The macrolide, if you remember, we spoke about the crows, exactly. And the fluoroquinolones, it was the man giving the lady the what? The flower, yes. Also the hyponatremia, look how much salt he's dropping. So hyponatremia. SS cysteine, so the agar requires cysteine, and the ship is made out of iron, yes? And here is your charcoal. Also, don't forget about this guy being. His being represents that the antigen is detected in the urine. This is super important. One more factoid. It can lead to lobar pneumonia. Yes? Lobar pneumonia. Okay, let's go back here. So think of a French legionnaire, a soldier with his silver helmet. sitting around a campfire, which is the charcoal, with an iron dagger. He is missing his sister, Sistine. I don't like this. I just like to do sketchy. When you do sketchy, you get all of them in the same place. 2 months later, you can remember the exact same picture and get all of the factoids. Okay. So the next thing is Legionnaires Disease, which is a severe pneumonia, often unilateral and lobar. Yes? We spoke about lobar pneumonia. Here it is. Okay. They will have fever. This is super important. GI symptoms and CNS symptoms. Well, did I say that they have diarrhea and at the same time pneumonia? This is what you should memorize. People with Legionella do have both GI symptoms and pneumonia, which is highly characteristic. Not a lot of pneumonias have that. Okay? So risk factors include old age, tobacco smoking, and chronic lung disease. Let's just wait for a second. Why do you think tobacco smoking can lead to Legionella? Why smoking can precipitate to Legionella? Exactly. The cilia will be destructed, which means that your mucociliary apparatus or escalator is not functioning. And if your mucociliary apparatus is not functioning, you will not be able to kick out the bacteria from your lung. Remember, this mucus escalator has cilia, has a mucus. Smoking dries them. Smoking destroys the cilia and make the mucus much more thick. Yes? Actually, by smoking, do we have more mucus or less mucus with the smoking? More mucus, exactly. Smokers tend to have this sound like all the time have this sputum production, all the time coughing. Why? Because they have ridiculous amount of mucus production. They call them like spitters, you know, like tobacco itself increased the mucus production. So there is like some categories of people who chew tobacco that leads to mucus formation, and that mucus formation will basically lead to them keep spitting, and when they keep spitting, they can bring like a bucket and start spitting in it. It's kind of famous in some communities. So also we have something called the Untitled Fever, which is like just mild flu-like symptoms, but mostly about Legionella. If you get a question about it, they want you to know about Legionnaires disease. Okay, so the next one is Pseudomonas Aeruginosa. Super important. Let's start with this. How does it smell like? Yep. It smells like grapes. So it smells sweet. Is it sweet? No, not really. So Pseudomonas aeruginosa, to start with, I want you to know one thing about it. It's a gram-negative. We established that. It's a root. But also it's catalase positive. Why we care about the catalase positive organisms? Yes, chronic granulomatous disease. Exactly. Guys, do you remember which organism was the only organism that was coagulase positive? No. It was Staph aureus. Staph aureus was the only coagulase positive organism. Good. And that helped it to make what? Why coagulase was important? What it helped Staphylococcus aureus to make? Well, basically it helped it to make, yes, it helped it to make fibrines, which helped it to make, yes, it helped it to make the abscess wall, okay? It makes the abscess wall. Good. So they write here Pseudomonas aeruginosa, it's aerobic, it's motile. Oh, nice. Do you remember which test we can do for motility of an organism? H2S, and if the organism is motile, which color it will give? Yep, it will be black. Good. So it's a non-lactose fermenting. On which agar do we check the lactose fermentation? McConkey agar, and if it was lactose fermenting, which color it will give? Pink, like E. coli, for example, yeah? So if you take a look at McConkey agar, just a second. Yes, so you can see here the pinkish one, this is lactose fermenter. The yellow one is not, okay? So let's keep going. It's oxidase positive, and we'll speak about other organisms that are oxidase positive. But just for fun, can you tell me one other organism that's oxidase positive? One more. H. pylori. What else? Campylobacter and Vibrio Cholera. Yeah? Okay, so Pseudomonas is associated with what they write here, with pneumonia. Yes, obviously. Sepsis and ecthyma gangriosa. Before I say anything, somebody wrote cystic fibrosis. Is it before 20 years old or after 20 years old? This is super important. This is super important. You will get a question about it in both one of the MBMEs that I will not tell you which one, and also you will get a question about it on your U-word. So there is a 20 years old cutoff, okay? If a patient has cystic fibrosis, okay, after 20 years old, they ask you what is the most common organism to lead to pneumonia in a cystic fibrosis patient when he's more than 20, it will be Pseudomonas Aeruginosa. What about before 20 years old? So on this side, it's Pseudomonas. Yes, before 20 years old, it's a Staph aureus. I just imagine like it's a Staph aureus, okay? So this is super important, and it goes something like this. So if we have a patient, and this patient have cystic fibrosis, okay? In the question they mentioned this patient age is like 22, okay? They tell you that he has cystic fibrosis. They ask you, what is the most common organism to lead to his pneumonia? Now he has a pneumonia with cystic fibrosis. He's 22 years old. Cystic fibrosis, most common organism. Any person who's more than 20, let me just make it simpler. Just imagine a straight line, okay? Anything to the right of the straight line will be Pseudomonas. Anything before this line will be Staph aureus. At this point, it's 20 years old. So he's 22. So most likely his pneumonia is due to what? Tell me please. Pseudomonas. He's more than 22, it will be Pseudomonas. If I give you a 7-year-old child, Staph aureus. If I give you a 34-year-old man, Pseudomonas. Now this is important. Can two patients with cystic fibrosis stay in the same room? Why? Guys, they are in love with each other. Why you don't want them to stay in the same room? Why it's not allowed? So here is the thing. Yes, exactly. So patient with cystic fibrosis can have some bacteria that is really bad for cystic fibrosis patient, and they will transmit it from one another. So we have the 6 feet rule, 6 feet low. keep 6 feet between them. They cannot get too close to each other because they will basically kill each other. Erythema gangrioso. Let's take a look at it. And after I show it to you, I will ask you what it looks like. It reminds us, by what other type of lesion. Guys, I showed you something like this before. It looks like what? Exactly, anthrax. Completely correct. We saw it and it looks like anthrax. Remember, in case of anthrax, what led to the... I told you like it had a black area and it had a red area. The red area is due to what? The red area is the edema factor, the cyclic AMP, yeah? What about the black area? The lethal factor, absolutely correct, which lead to necrosis, yeah? So, erythema gangriosom looks like it. So, how can you differentiate? It's all about two things. The history, that's one. And, yeah, oh, that's a good one actually. IV drug users are at high risk. And one more thing, guys, these lesions in general, are they painful or painless? I mean something like this, is it painful or painless? It's painless. That's important, it's painless. Yep. Good. So, UTIs can be as well from Pseudomonas Aeruginosa and diabetes. Okay. So, osteomyelitis as well can occur from Pseudomonas, and it has a mucoid polysaccharide capsule which makes it quite thick. Also, they can lead to otitis externa. Guys, do you know when you feel your ear is itchy and you start pulling your ears because you put these headphones for 12 hours per day? Yes, exactly. Or you go to a swim and you come back home and then your ears start like itching you. So this is what? Yep, it could be from contact lenses as well. Good. So yeah, this is basically Pseudomonas. Guys, in otitis externa, which antibiotic do we use? We do use ciprofloxacin. You just need to know it because it's like a really common thing. Like even in early time in your practice, you will do it a lot. So ciprofloxacin, 1% in the ears, twice a day for 1 week. Okay? So also nosocomial infection like from catheterization or contaminated equipment. Also, some addict people can inject themselves with this, which can lead to, systemic infection. Guys, IV drug users use also to cause themselves endocarditis by which bacteria, please? Which bacteria in infectious endocarditis? Yeah, Staph aureus, absolutely correct. Yes, which valve does it affect? Tricuspid. Are the vegetation big or small? Big, big, big. And does it affect, basically destroyed valve or healthy valve? It's healthy valve. Exactly, it's the healthy one. Excellent. Good. So, no, sterile endocarditis is different. Sterile endocarditis means that the patient got the infection, the endocarditis, not due to the bacteria. You mean, what do you mean? For example, in case of lupus, we get endocarditis, but we don't have bacteria inside of the vegetation. Sterile injury, you are correct. Yes, if that's what you mean. Yes, absolutely correct. Good. So, skin infection, they get this hot tube folliculitis. Basically, their hair follicles becomes like, yep, it draws a map. Take a look. It's quite cool, actually. Oh yeah, boils all over the place. Nice. This is why they chlorinate our water. Yeah. Also they put like some substance that can react with some person accidentally forgot his cell phone. Okay, so hot tub folliculitis, Here it is. Okay, so they write wound infection in burn patient. They love the burn patient, and they like to show you burn patient and then ask you, oh, which what will cause it, you know, what will cause infection in this patient. And you must know that it is Pseudomonas. Oh yeah. And what make me think that this is Pseudomonas, guys? What is in this picture? When I look at it, it makes me think it's Pseudomonas. Exactly, it's a greenish. If you zoom in, it looks like a greenish, yeah? If I smell this, how it will smell like? Like a grape. Yep, exactly. Okay, I will speak about why in a second. Yes, you are right, actually. So, okay, mucous polysaccharide capsule may contribute to chronic pneumonia in patients with cystic fibrosis due to biofilm formation. Basically, we spoke about cystic fibrosis patient having this a lot of a Pseudomonas infection, especially at which age? Which age? Like to have Pseudomonas in cystic fibrosis? 20 plus, absolutely correct. Good. Because they have this biofilm. Biofilm, I will take a moment on this actually. Biofilm, we saw them, if you remember, in staph epidermidis, yeah? We are seeing them again in Streptococcus, in Pseudomonas. So what are biofilms? Biofilms is a polysaccharide structure that basically help to make stuff stick, okay? I imagine it's polysaccharide, so it's a sugar. I like to imagine it as honey. It makes everything stick together, okay? So it's important because if it binds to something, it will not let it go, okay? Good. It produces PEEP, phospholipase C, which degrades the cell membrane. Because remember, what is our cell membrane? It's a phospholipid bilayer. Endotoxin leading to fever and shock. Guys, do you remember which which clotting factor is activated by endotoxins? Which clotting factor is activated by endotoxins? Clotting factor. Remember, I told you about something called the tissue factor. Tissue factor, yeah? And this tissue factor was activated. Just a second. Tissue factor is factor number 3, basically. Yes, I just need to find it. Oh, here it is. So you can see the endotoxin activate the tissue factor, which lead to coagulation cascade, leading to DIC. Let's revise this together really quick. Okay, we have coagulation, which consumes a lot of a platelet and the clotting factor. So what will happen to the clotting factor and the platelets amount? Up or down? Down. Okay, so initially you will have a thrombosis. Then after you consume all of this clots and all of this platelets and all of this clotting factor, you will have a hypocoagulable state. This is the definition of the IC. Yeah? Good. So, let's take a look. The pigments include bioviridin and biocyanin, which have this blue-green pigment, and they can generate reactive oxygen species, which can kill the tissue. Okay, please keep in mind that it can be in case of, somebody wrote this actually, contact lenses. Yes, basically the keratitis, which is the corneal, yes, you are absolutely correct. The corneal ulcers, keratitis, and contact lenses wearer, and minor eye trauma. So please keep in mind of the contact lenses. Guys, in contact lenses, what other microorganism can infect you? From wearing contact lenses for a really long time. Well, Staph aureus is correct, but there is one that is really loved by the US MLE. it's quite rare actually. I have like to say it's you remember like this anti-amoeba? It can be like amoeba. Amoeba can affect the contact lenses. They want you to know this. I don't know why. It's quite rare. I tried to look it up. Like, it's super rare. But for the USMLE, they want you to know that contact lenses, if you put them for a really long time, that, oh no, not a bacteria, parasite. Yes, I said microorganism. Yes. So, by the way, I tend to trick my student a lot. I give them stuff like that. So, amoeba. So amoeba is the one. Okay, Acathema gangliosum, we took a look at it. So it's a rapidly progressive necrotic cutaneous lesion. Take a look at this. Yep, quite disgusting. So it's caused by Pseudomonas bacteremia and typically seen in the immunocompromised patient. So those who, for example, in HIV or under chemotherapy, yeah? Okay, let's start with the treatment. Most preferably, antipseudomonal penicillin in combination with beta-lactamase inhibitor. Basically, the bacteria are smart. They have this plasmid and they can make something called a beta-lactamase. So this beta-lactamase destroys the beta-lactam ring inside of the antibiotic, which make the bacteria happy and able to survive your bacteria, yes? But we humans are smarter. We give the beta-lactam antibiotic. In addition to it, we give also some other guy that can deal with the beta-lactamase, yes? So this time when the beta-lactamase will come to destroy the beta-lactam ring, the beta-lactamase inhibitor will destroy it. Wow, it's just like interesting. Like the bacteria is making the beta-lactamase to protect herself against our beta-lactam antibiotic. So we decided to make a beta-lactamase inhibitor to kill the protector of the bacteria itself. Oof, that's a mouth twist. So again, bacteria make a beta-lactamase, yes, which is an enzyme, beta-lactamase. This beta-lactamase destroyed the beta-lactam ring of the antibiotic, yes? So if you give it normally to the patient, he will not be able to destroy the bacteria if you give it alone. So you need to give an inhibitor of the beta-lactamase. For example, the tazobactam, yes? Or the clavulanic acid to destroy this guy. So, for example, here we have piperacillin tazobactam. So the piperacillin is the antibiotic. The tazobactam is the destroyer of the beta-lactamases. Also, third and fourth generation cephalosporin can be used like ceftazidime, DIM, and cefabim. Also, monobactam, fluoroquinolones, and carbapenem. Guys, carbapenem tend to work almost every single time. So should we use it every single time in a Pseudomonas aeruginosa infection? No. Why no? Sounds like fun. Yes, resistance. We already sadly are reporting cases of resistance to carbapenem. So the last thing we want to do is to create more resistance. It is one of the last resort, because if you get this resistant table and the patient is resistant against anything, you cannot treat him. He's dead. Okay, guys, we finished the page. Let's take a little break and come back after the break. See you guys in 10 minutes. I will tell you about aminoglycoside when I come back. I forgot to start recording. Nobody reminded me. So, Yersinia enterocalytica. Yersinia enterocalytica is super important, and it can lead to what disease? Yersinia. Does anybody know about Yersinia? It's actually a good sign that nobody knows about Yersinia. Okay, I'm not saying enterocalytica. Let's say Yersinia pestis. What does Yersinia pestis lead to? The plague. Bubonic plague. Yes. Good. Okay. Yersinia enterocollitica, on the other hand, does not lead to the plague. This is different. So it's a gram-negative pleomorphic rod, which look like a coccobacillus. Anyway, it comes from bat feces, like from cats and dogs, or contaminated milk or pork. But what really they want you to know is the bat feces. Bat feces. Who like to eat bat feces? Kids. Yep, exactly. So it can lead to an acute bloody diarrhea. This is important. Pseudoappendicitis. What do I mean by pseudoappendicitis? When you bring this patient, put it in front of you. This is his umbilicus, okay? You check the McBurney point. It's a freaking painful in this patient. So they have an appendicitis-like symptoms, and you palpate it. All of the clinical signs of appendicitis. You do an appendectomy on him, and his appendix is normal. So, pseudoappendicitis, right lower abdominal pain due to mesenteric adenitis or terminal ileitis. Okay? Basically, remember, we had lymph group called the mesenteric lymph node. Yeah? So these can be inflamed. Also, terminal ileitis. What is getting inflamed here? Which lymphoid tissue is located in the ileum? Which lymphoid tissue? Yes, exactly. Mucosa-associated lymphoid tissue, which are in case of ileum, are the Beer's patches. Yeah? So, they can lead to reactive arthritis in adults. What is reactive arthritis? Can somebody tell me the triad? Reactive arthritis. Uveitis, they can have, I agree, can't see. They cannot see, it's the uveitis. They cannot climb the tree, that's arthritis. What else? And urethritis, yeah? They cannot see, cannot climb the tree. That's reactive arthritis. Guys, which HLA is associated with reactive arthritis? Human leukocyte antigen, which one? Human leukocyte antigen number what? Number, I want a number. Come on, let me give you a clue. It also led to psoriatic arthritis, ankylosing spondylitis, inflammatory bowel disease, and reactive arthritis, and uveitis. All of these are from the same HLA. Which HLA? HLA B, which number? 27. B27. Good. So lactose fermenting enteric bacteria. So fermentation of lactose will lead to pink colonies on McConkey agar. We saw that. Examples include all of the Enterobacteriaceae, which are family of bacteria that are normally located in our guts. So Citrobacter, E. coli, Enterobacter, Klebsiella, and Serratia. Serratia is a catalase positive organism, so it can lead to infection on the chronic granulomatous disease patient, yeah? So, E. coli produces beta-galactosidase. E. coli can produce beta-galactosidase, which break down lactose into glucose and galactose. So that means E. coli can ferment the lactose, and that will give which color? Which color it will give? Pink one, which we saw. Also, there is something called EMB stain, EMB agar. I show it to you like in the first class in micro. Lactose fermenters grows as a purple black colonies, while E. coli grows colonies with a green shine. Let me show you this. Actually, it's really cool. 1 second. Yep. So it has this greenish hue. I mean, you see it once and you cannot forget about it. It looks kind of cool. Good. So that's E. coli in the EMB type of stain. Yeah? So let's go back here. Yeah. Okay, that's it for this page. Good. Next page. So the next page is speaking about E. coli. So we have a gram negative. Oh, yeah. E. coli is a gram negative, but indole positive route. This indole positive is just a biochemical feature of it, okay? There is nothing else you need to know about it. It's just like a biochemical feature. E. coli virulence factor are fimbriae, which are super important for it to connect to stuff, yeah? So fimbriae, like the P. pili, help it to grab stuff. So in the urinary tract, is it a good idea for someone with a urinary tract infection to be a lot or not? It's a super good idea. Why? They clear out the bacteria faster. Yes? So the bacteria know that. Bacteria know that. This is actually one of the causes why, like, during the sexual intercourse, we tell them, like, after the sex, always go and pee. Because if they don't pee, they can get the UTI that can ascend, which is super dangerous. This is some of the, sex hygiene you must teach your teenage patients. So, okay, fimbriae, cystitis, and pyelonephritis. It's the B. pili. Also, they have the K. K stands for capsule, which can lead to pneumonia. Neonatal meningitis as well. While the lipopolysaccharide endotoxin can lead to septic shock. Okay, guys, do you remember how lipopolysaccharide led to vasodilatation? How lipopolysaccharide led to the vasodilatation? Well, yes, I see it. I see it. Somebody wrote nitric oxide. Yes, it's nitric oxide, exactly. So if you open the chapter in cardiovascular, you take a look at the smooth muscle, all of these processes. If you take a look at this little note, bacterial lipopolysaccharide activate the nitric oxide synthase, converting L-arginine into nitric oxide, which make plenty of cyclic GMP, which stimulate the MLC phosphatase, which is myosin light chain phosphatase, which lead to dephosphorylation of the myosin phosphate actin complex, and that lead to relaxation of the smooth muscles. Relaxation of the smooth muscles will lead to vasoconstriction or vasodilatation. Vasodilatation, you are absolutely correct. Good. So let's go back here. Okay. So enteroinvasive E. coli are microbes that invade the intestinal mucosa and can lead to necrosis and inflammation. So invasive E. coli can lead to dysentery. Why? Because it's invasive. What does the word dysentery mean? Can somebody remind me? Dysentery. It's a bloody, absolutely correct. So clinical manifestation will be similar to shigella, yes? So, which is like dysentery, bloody diarrhea. That's the main thing about shigella. Okay, enterotoxic E. coli, toxic. Is there any invasion with the toxin? Enterotoxic. No invasion. So it produces a hate labile and a hate stable enterotoxin. No invasion. No blood. It's a watery diarrhea. Yes? Okay. So it can lead to this hate stable and heat labile toxin. I hope you remember about this toxin that I explained long time ago. I told you we had this hate labile and it's labile in the air and stable on the ground. Stable on the ground, here it is, more cyclic GMP. Yes? More cyclic GMP means less resorption of sodium chloride in the gut, and the sodium chloride will be excreted in the gut. If you have more sodium chloride inside of the lumen of the gut, what sodium likes to bring with him? What sodium likes to bring with him? If you cannot reabsorb him, he will take the water from your intestine and lead to diarrhea. Also, other mechanism is the heat labile one. The heat labile in the air is cyclic AMP, which activate the chloride channel, and you will have more chloride secreted into the gut. More chloride to the gut, and that will lead to more water to the gut. More water to the gut will lead to watery diarrhea. Yes? Kind of similar to Vibrio Cholera type of mechanism, actually. So, yes. So here we have the following. Okay, enteropathogenic E. coli. This I have never saw a question about. So, but I cannot tell you not to study it. I have to read it, but nah. So, enteropediatric E. coli. That's the only thing you need to know. So, no toxin is produced. It adheres to the apical surface and flattens the villi. So, it's basically lead to less surface area because it blunts the villi. It reminds me kind of Giardia. Giardia does the same thing. So that leads to diarrhea, usually in kids. So enteropediatric E. coli. Okay? So the last one, enterohemorrhagic E. coli. This subtype, O157H7, is the most common serotype in the US, often transmitted via uncooked meat and raw leafy vegetables. Where do we find uncooked meat, undercooked meat, and leafy vegetables in the same plate? Raw leafy vegetables. Yep. Really bad cooked burgers. Well, sushi as well. I agree. So, yeah. So these patients have this Shiga-like toxin. So Shiga toxin lead to hemolytic uremic syndrome, in which they have the anemia. Remember what I told you guys. I told you that the Shiga toxin lead to destruction of which cell? Remind me, please. Which cell is destroyed by Shiga toxin in the vessels? Endothelial cells, you are correct. When I destroy the endothelial cells, what gets exposed? The collagen. Yes, subendothelial collagen. Okay, and the vulnerable brand factor bind to it. Okay, so now we have this coming here. So platelets start binding to it, yes? So platelet bind to it, they created what? Microthrombi, yeah? So when I did all of this platelet aggregation, in my circulation, will there be more platelet or I consume them? And I will have less? Less platelets, exactly. So look what they write. No, before you read what they write. Now the RBCs come. And the RBC is moving through here. So what will happen to it when it hits this microthrombi? It will get sheared. It will get sheared, exactly. So now it will get sheared, something like this, helmet cells. So this, we call it schistocyte, absolutely correct. So they will have anemia, thrombocytopenia, and this thrombosis can occur into the kidney. Yes, the microthrombi can occur in the kidney, which can lead also to the problemo. So add an acute kidney injury due to microthrombi forming on damaged endothelium. Okay, all makes sense. Mechanical hemolysis will occur with schistocyte formation on the peripheral blood smear. Platelet consumption will occur and decrease renal blood flow because of the microthrombi. Let's take a look at the schistocyte. Here it is, schistocyte, yeah? Good. Okay, so they write dysentery, toxin alone causes necrosis and inflammation. It does not ferment sorbitol, however, versus other E. coli, which do ferment sorbitol. Enterohemorrhagic E. coli are associated with hemorrhage, hamburgers, and HUS. So hemorrhage, hamburger, and HUS. Okay, good. So now Klebsiella. It's a gram-negative road and intestinal flora that causes lobar pneumonia. But you need to know which category of patient. It's not normal patient. This patient who gets the pneumonia, it's in a patient with alcohol overuse and patient with diabetes when aspirated. What they aspire? The Klebsiella. From where? Well, it's a normal oral flora, so they can aspirate it from there. So very mucoid colonies. Look at these colonies. It looks like jelly. So before I show you that, the colonies are quite thick, and you need to know why they are thick. They are thick because they have a really thick polysaccharide capsule, okay? So they have a really thick polysaccharide capsule. That's why they are thick. So okay, can you see how thick it looks like? Yep. Quite thick. Like freaking plastic or rubber or something. See? He's taking even... Oh, this is a perfect example. Good. So the next thing is... Yep. Very mucoid colonies causes by abundant polysaccharide capsule. They can have dark red current jelly sputum, which is blood with mucus. Guys, they don't mention the jelly sputum anymore, okay? They will tell you it's a thick sputum, okay? Something like this. I hate to disgust you guys, but it looks like jam. Yeah. Happy breakfast, everybody. So, and yeah, it's quite thick. Guys, if you read the word current jelly stool, what is that? Current jelly stool. Current jelly stool is basically in intussusception, which is another disease. Okay, anyway. So also causes nosocomial UTIs associated with evaluation of multidrug resistance. Okay, so what is leading multidrug resistance? The Klebsiella. Klebsiella organism are now becoming really resistant to so many antibiotics that is starting to become a biohazard. So aspiration pneumonia, that's the A, B, C, D. So aspiration pneumonia, abscesses in the lung and in the brain, current jelly stools, diabetes mellitus, and ethanol overuse. How can ethanol lead to Klebsiella? I mean, how the hell they are related with each other? Well, aspiration pneumonia. When somebody gets really drunk, he can have this aspiration pneumonia. Okay? So, the next one is Campylobacter Jijoni. So it's a gram-negative, comma-shaped or an S-shaped with polar flagella. It's an oxidase positive. Can you write me, please, what other oxidase positive organism you know? What other oxidase positive organism do you know? Okay, Pseudomonas, that's one. Vibrio Cholera, that's two. Campylobacter, that is a three. Good. So they grow at 42 degrees Celsius, which is quite hot. Major cause of bloody diarrhea, especially in children. It has fecal oral transmission through person-to-person contact or undercooked contaminated poultry or meat. What other infection was it due to consumption of poultry? Chicken. Salmonella. And pasteurized milk as well. Contact with infected animals like dogs, cats, and pigs is also a risk factor. You know, guys, to be fair with you, they will give you a scenario about some people going into a picnic and they cooked their food bad and they ate it, okay? And then they, like couple of weeks later, 2-3 weeks later, they start to have this paralysis, which is due to Guillain-Barré syndrome. I have the following question. Guillain-Barré syndrome, is it an ascending or a descending paralysis? It's an, okay, it's ascending. So which disease does it have a descending paralysis? We spoke about it. A disease that has a flaccid paralysis that is descending. Clostridium botulinism. In babies, do the babies have to get infected by the spores or the toxins in case of Clostridium botulinism? It was the spores because they have a sterile intestine. But us adult, we need the toxin. Okay, it also can lead to reactive arthritis. Know about the Guillain-Barré syndrome. Do you know what other microorganism can lead to Guillain-Barré syndrome? When I say microorganism, it can be not a bacteria. So, Zika virus. What else? Orthomyxovirus. Good. Nice. So, next topic, we are going to speak about Vibrio Cholera. And I think I'm going to call it off after Helicobacter. I think it will be a good place to stop. So, but let's speak now about Vibrio Cholera. Vibrio Cholera is a gram-negative, flagellated, coma-shaped, oxidase-positive organism. What other organisms are coma-shaped, guys? What other organisms are coma-shaped? See, this is coma-shaped. Campylobacter, that's one. What else? Vibrio cholera, that's two. Some people might debate about H. pylori, but I'm not sure. I know that it's curved, and people say that it's also coma shaped, but when I look at it, it looks like a road for me. But people say it's also coma shaped. So, Vibrio cholera grows on an alkaline media. This is super important. It's endemic in the developing countries. It produces profuse rice water diarrhea via the enterotoxin that permanently activates the GS. More activation of GS, what will be increased? Cyclic AMP. Okay. More cyclic AMPs, more activation of the chloride pump. More activation of the chloride pump means more chloride in the lumen of the intestine. More chloride in the lumen of the intestine means more diarrhea. Yeah? So again, this is important. Vibrio, cholera, cyclic AMP relationship. So, what happens exactly that the Vibrio cholera produce Vibrio toxin. It binds to the epithelial cells and they activate cyclic AMP. A lot of cyclic AMP will produce plenty of chloride that will go out. What the chloride likes, guys? We have table salt. What is table salt made out of? What is table salt made out of? NaCl. So it likes sodium. Sodium will be sucked paracellularly, which means between the cells. Sodium, when it goes out, what it will take with him? Water, leading to watery diarrhea. Yeah? Okay. So, sensitive to stomach acid, acid labile, so that means you will require a large inoculum to get infected, unless the host have decreased gastric acidity, in which case the patient will have a low gastric acidity. Tell me, please. Exactly, if he's using a protein pumps inhibitor. It's transmitted via ingestion of contaminated water or an uncooked food like raw shellfish. So please remember about this decreased gastric acidity, which is like somebody taking omeprazole, which is a proton pump inhibitor and used to treat ulcers. And yeah, it can be transmitted via ingestion. It's fecal oral as well, okay? And mostly it comes from like some shellfish type of thing. Okay, so it treated promptly with oral rehydration solution. Which antibiotic do you give in case of Vibrio cholera? Which antibiotic should you give? Is it doxycycline or aminoglycosides? Got you. Nothing. You only give the oral rehydration therapy. Good. So, Vibrio vulnificans. It's a gram-negative bacillus which is usually found in marine environments. Okay? It leads to severe wound infection and septicemia due to exposure to contaminated seafood. Oh yeah, Vibrio vulnificans is really common. But here is the interesting thing about it. Which patient is at high risk of Vibrio vulnificans? It's not written in first aid, but they ask it in U-word. Which patient is at high risk for Vibrio vulnificans? The answer are those patients who have hemochromatosis. They have plenty of iron in their body, and this bacteria love iron. So people with hemochromatosis and actually also hepatitis C tend to have Vibrio vulnificans. Write a note about that. So gram-negative bacillus, usually found in marine environment. It causes severe wound infection or septicemia due to exposure. Due to exposure to contaminated seafood. Seawater. So it presents with cellulitis that can progress to necrotizing fasciitis in high-risk individuals, especially those who have liver disease like cirrhosis, from hepatitis C, for example, yeah? So, serious wound infection, you must surgically debride. Okay, the last one. We have H. pylori. It's a curved, flagellated, motile. Oh, motile. What are you thinking about, guys? A motile organism. H2S, excellent. Black, excellent. Good. So, a gram-negative rod that is a triple positive. Catalase, oxidase, and urease positive. When I say an organism is urease positive, what does it mean? This urease can convert what to what? Yes, it converts urea into ammonia. Guys, this is important. I want to tell you a little story about how we get the ulcer, because you know, H. pylori lead to ulcer. And to understand this, take this look. I'm going to draw the wall of a stomach, okay? So we have the mucosa. Let's imagine the mucosa is here. We have the muscularis and all of the other layers, okay? So, if we speak about this bacteria, the H. pylori, it will come and it will move inside of your mucosa. It goes under the mucosa and it makes its urease work. This urease will produce plenty of ammonia. Is ammonia alkaline or acidic? Alkaline. It's alkaline. Good. So it's alkaline. Well, your stomach will start thinking, what the hell? The walls feels alkaline. So what should the stomach do? What it will be doing when it senses alkaline? Make more acid. So the stomach she's like, oh, we have an alkaline problem. Let's make more acid. So they make more acid, yeah? The acid will come and burn the mucosa. If we destroy the mucosa, what we will have? If we destroy the mucosa, we get an ulcer. I hope it makes sense. So, yep, absolutely correct. So take a look what they write. H. pylori is a curved, flagellated, motile, gram-negative rod that is a triple positive, catalase positive, oxidase positive, and urease positive. It can use urea breath test or fecal antigen test for diagnosis. Okay, so basically with the urea breath test, the thing that happens that in the breath, how do we do it? We bring the human being and we tell him, okay, consume these pills, please. What does the pills contain? The pills that we give to the patient to consume contains urea, yeah? So we make him eat this urea Oh no, not this one, sorry. We make him eat this, oh yeah. We make him consume the urea, and after consuming the urea, it will go to the stomach. Inside of the stomach, the urea will be transformed into what? Into ammonia by the H. pylori, yeah? H. pylori will transmit it. If H. pylori does not exist, can it be transformed? Will it be transformed to... No, it will not. So after giving him that, it will be basically exhaled by the lung, and it will go to the heart because it's absorbed, and then it will go to the lung, and he will exhale it out. So if it was positive, it's positive. But it was negative, it's negative. Done. This is how you do the test. So this is basically, yeah, you fill it in a breath bag. Quite interesting, I have to say. Good. Yep. So, but is it perfect, this test, guys? Is it perfect? Does it always work? The answer is no. Excellent. So, which test is preferable? Fecal antigen. Absolutely correct. So, you can use urea breath test or fecal antigen test for diagnosis. Urease produces ammonia, creating an alkaline environment, okay? It can be cultured, but it takes a lot of time, and it's not time sufficient, you know? Just a little bit of feces, you can diagnose it correctly. You give the triple therapy 14 days, and it's gone. So no need to culture it. But it can be cultured, and actually I will show you a picture about its culture because they want you to know how it looks like. So it colonizes mainly the antrum of the stomach, and this is interesting. How can you remember that it's the antrum of the stomach? What is the name of the bacteria? It's Helicobacter pylori. What is the pylorus of the stomach? Where is the pylorus of the stomach located? Helicobacter pylori. No, that was the fundus. So if you take a look at the stomach, this is the pylorus, which is near the antrum. So the pylorus is part of the antrum. The upper portion is the fundus. Okay? So when we say Helicobacter pylori, it like to affect this region. Yes, it colonizes this region basically. So it doesn't mean that the ulcer will be here. The ulcer will be here actually, at the lesser curvature. But it means that the bacteria will colonize this area. Yeah? Helicobacter pylori. Okay, good. So it causes gastritis and peptic ulcers, especially the duodenal ones. Risk factors for peptic ulcers as well. The H. pylori can lead to peptic ulcer. We described how. Also, it can lead to gastric adenocarcinoma and malt lymphoma. Now I have an interesting. Remember when I told you cancer is irreversible? Like if someone has cancer, he's done. But malt lymphoma is caused by H. pylori. If I treat the H. pylori, will the malt lymphoma go away? Yes, it will. Yes, it will. Okay, that's the only exception you need to know for the USMLE step 1. Malt lymphoma can be reversible if you treat the Helicobacter pylori. So most common initial treatment is a triple therapy, which contains the following. Amoxicillin, sometimes we give metronidazole if the patient is allergic to penicillin, clarithromycin, which is a macrolide, and protein pumps inhibitor. Antibiotic cure pylori, so amoxicillin, clarithromycin, and BBIs. Bismuth-based quadruple therapy is concerned about macrolide resistance. So in some countries, or some communities I should say, the doctors know already that in this community, 99% of all H. pylori are resistant to macrolide. So is it smart to give a macrolide, or that will lead to more resistant? It will lead to more resistance, so you will not risk it. You just give the quadruple therapy, which contains bismuth, What is bismuth? Bismuth is type of a drug that leads to creation of mechanical barrier inside of the stomach, which protect your stomach from the acid. So when your stomach is protected against the acid, done. You have yourself a protective barrier, and you can give other antibiotic to kill the bacteria, and you will be good to go. So that's it for H. pylori. Before I end the class, I want to show you a picture of H. pylori in histology. They do show it, so I want you to take a look. Oh, really bad image. Okay, this one. Always when you cannot see bacteria good, check for the silver stain. It makes it look amazing. So, okay, can you see the H. pylori? And can you see how some of it is infiltrating under the mucosa? See, it's coming inside of the mucosa. Yep. Here we go. So, and that's it for today, class. Easy and simple. We finished a lot of material, much more than you think. For next time, your task is to finish, which is tomorrow, all of the spirochetes. Really interesting topic. Lyme disease, leptospirosis, syphilis with all of its types, diagnostics of syphilis. Also, please do all of this Gardnerella, chlamydia, with all of its type, zoonotic infection, and please do all of the rickettsial infections as well. So I will see you guys tomorrow, and have a nice evening. Bye bye, everybody. Oh, the video will be up in a few minutes.